We're live.
And we are live, guys. I'm Dr. Joseph Cipriano, and today we have our patient here, Lady Luck HQ. Lady Luck, she is a big-time slot machine.
slot player. Yeah.
She does a lot of videos out in Las Vegas, Nevada. Does a ton of with the casino and the gaming industry. She showcases a lot of her
My
winnings.
hand pays.
Yes.
My hand pays.
Her hand
hand
pays.
pays.
Yes. So, today we have somebody that actually has been adjusted by me before. So I just kind of want to give a little bit of a background history of her, also kind of give everybody an update on what is going on with myself in my new office and location there. So, as many of you guys have been watching and paying and following along with my channel, our patient here, she has had headaches and migraines in the past. These complaints really have been kind of with her for years of your life. You talked about then in that video the different medications that you were on and things of such forth. How have things been going with you?
Things have been going well. So I have, in the past, my headaches or migraines were about once a week.
Okay.
And they've kind of dwindled down to once or twice a month. So they have been getting better, but they are still occurring.
Okay. Okay. So, well, I mean, the one thing is, it's hard for you, I know, to come out and be able to see me. It's just difficult with schedules, things of such sort.
Yeah.
I know you did tell me that you had tons of relief after.
Oh yeah, a lot of relief right after, yes.
And that's exactly what chiropractic is meant for. I mean, a lot of the times you have those nerves, and especially in that upper portion of the cervical spine, those nerves, when they have pressure being put on it, it can cause tension type headaches. That, I mean, in her case, she was getting those migraines, and the one thing, especially when the first route that you took was, you went to your primary care physician and, went the medical route, which obviously can be good at times, but in your case, it just wasn't really ideal for you, just the medication that they wanted to put you on, or did put you on.
It helped, but what it also did was it made me feel like I had an elephant on my chest. It just made a lot of pressure. So it did alleviate the migraine, but it just caused another problem, which didn't really make any sense. So I stopped taking it and started seeing the chiropractor.
Yeah, so as a chiropractor, what we search for is we search for the root cause of problems. We don't just treat and search for symptoms and give you basically a medication to put a Band-Aid over that symptom. Okay. What we're looking for is, if you have a headache, we want to find exactly why there's a headache, what is causing that headache, not just treating that symptom. Funny things that I'll tell people in the office is, if your car's check engine light turns on, are you just going to put a piece of tape, over that check engine light and keep driving? No. You're going to stop, you're going to go to a mechanic as soon as you can, and you're going to find out what the root cause of the problem is. Same as with the chiropractor, we're not just going to, treat the symptom. We're not just going to put a piece of tape over something. We're going to find out why, you are having an issue, and that's why we treat the problem, from the nerve and from the spine. Because you got to realize, when you're born, your first organ that is developed is your brain and your central nervous system. And you got to realize, as our body, those are the only two things that are completely protected by a skeleton. You have your skull that protects your brain, and then you have your spinal cord that is protected by your spine. You've got the bones that are literally protecting those organs. If you think about it, your heart, yes, it is encaged within the ribs, and your lungs are, but look at everything in your abdomen, your intestines, those aren't protected, by a specific bone. So we've got to look at, our body's way and just how it functions. So if our brain controls the entire function of our body, we want to focus on making sure that there's a clear path from the brain down the spinal cord, out the nerves, every organ, cell, and tissue in your body. Simple things that I'll tell patients is, if your head was cut off, what is going to happen to you?
You die.
Exactly. So the nerve that's going to your heart, if that's cut, what is going to happen to your heart?
You die.
It's going to stop beating, and you would die. So if there's pressure that's put on the nerve that's going to, your heart or your lungs over time, if there's pressure on that nerve root, is that heart going to get healthier or is it going to get worse over time?
I see where you're going with this.
It's going to get worse. So as a chiropractor, what I'm doing is I'm finding areas where there is pressure being put on the spine, pressure being put on the nerve, and as a chiropractor, I'm doing an adjustment, and with that chiropractic adjustment, I'm removing pressure off that nerve so your body can heal and function, as intended. So now what may happen after that, such as, like I'm treating a musculoskeletal issue. If headaches clear up, if other symptoms do clear up, that is awesome. Like those are secondary effects. But what I'm focusing on a musculoskeletal with the spine being out of alignment. So those are things that I focus on as a chiropractor. If other things tend to get better because of an adjustment, those are just awesome things. But this is why I love being a chiropractor and the profession that I'm in. Just the amazing things that that you see every day. I was able to adjust the patient in the office just a couple days ago, and he went from having extreme knee pain, and after a single, session with me, right after even doing my Y-strap distraction on him, he literally, he messaged me on Instagram and told me just the amazing relief that he was having and his knee pain going away. And the thing is, if you watch that video, I don't even address his knee at all. I'm nowhere near his knee. I adjust the spine, I adjust, the nerves, and that is what I, as a chiropractor, am adjusting. I never did one adjustment on his knee. But in his case, nerves, especially from that lower back, that's where they travel. They travel down, down the thighs, down to the knees, all the way to the feet. And when you remove the pressure off those nerves, other areas tend to get better. So today, we do have Lady Luck HQ here, and when is the last time you've had your last migraine? Just so we know.
Probably about 2 to 3 weeks ago.
Okay.
They're not as frequent anymore.
Okay, that's always a good thing.
Yep.
Love that, love hearing that. I know you probably love not having those migraines anymore, or as frequent as you do. So what we're going to be doing today is we're going to go through and we're going to do a full head to toe chiropractic adjustment. We're going to check areas, going all the way from the base of the skull, going all the way down to the sacrum. We want to see if there is any pressure being put on the nerves. And basically I'm going to run through how I test for things, where issues may be arising from, and then also we'll go through and do the actual adjustment, and you'll be able to really see, what a typical, chiropractic experience would be like. Okay? Okay?
Alright.
So we are going to have you start by laying face down for me, okay?
Okay. So Dr. Cipriano, Gamer Thrills says, Doc, I need a beard like yours.
To be honest, I have been growing my beard out, I don't know, probably 4 years or so. I just keep it trimmed up, but I'm telling you, once you get through that like awkward stage of having a beard, you'll be fine. Just kind of go in hiding for a couple months until it looks good, and then hang out with your buddies again, and you'll have that cool beard. So don't worry, keep it up.
And now he is asking, at any home techniques for lower back pain reliefs other than Tylenol? That's what doctors give me when I say that I have back pain.
Depending on what's going on, usually if it's something that was an acute, meaning, if it's something that you did the day before, I typically have patients, I would ice their back, but if it's something that's been chronic and going on for a long time, I'll usually have them do some type of heat compress on their back, and I do things such as 15 minutes on, 15 minutes off, but it does depend on a little bit of your background history and what's kind of going on with the actual issue at hand, if it's a chronic or an acute type issue.
Okay. A few people are sending their hellos. Alex Barr and Adam Salazar.
Hi guys, how you guys doing?
Adam Salazar is asking if you ever come to Texas.
Actually, funny thing, I started my chiropractic career in Texas. I started in the Woodlands, which is North Houston, and I practiced out there for quite some time, and From there, that's ended up how I learned the technique of the Y strap. And during that time, to be honest, I had no idea who Dr. Gregory Johnson was. If I did, to be honest, I would have gone to his clinic. I would have loved to have met him, especially with his technique with the ring dinger. Awesome technique. It is very similar to what I do with the Y strap, which you guys will see me do today, on our patient here. But yeah, so I have been out there. I'm not sure the next time I will be going out there, though, to be honest.
Okay, and then Mr. Heisenberg is asking, oh, I'm sorry, he's saying he can cure your headaches, friend. Or lady lick.
I wish things could be cured and with a simple thing, but, usually, things take a little bit of time and effort to be completely gone.
Okay, Picante's World is saying hello to the both of us.
How you doing? You are definitely by far my favorite #1 fan out there. Always with the best comments. And yeah, sorry we weren't able to do this last night because I originally told you last night, but yes, we were able to get everything up and going today.
Michael Lau is watching from Europe. Woohoo!
Dang.
That's awesome.
I know, that's actually really cool being all the way up there in a completely different country. I mean, here we are in America, so. Alright, but everyone, so what I'm doing is, it's called palpating. All palpating means is I'm going up and down her spine and I'm feeling her spine, I'm feeling her muscles on either side. So what I look for and check as a chiropractor is symmetry of the body. So you want almost like a mirrored image. What you feel on the right side, you want to feel on the left side. You're feeling for muscle tonicity. You're seeing if anything is almost like you can really see people, especially if you look at their shoulders, you look at their leg length. You can tell if hips are imbalanced. If you come down here by the feet and you look at the leg length, and you can tell you've got the right foot is shorter than the left. So what that's meaning is in her hips, you're going to have one hip that's drawing up compared to the other side. So we have that right leg that's drawing short. So you got two different ways, especially when looking at a short leg. You can have the hip that's out of alignment. The hip can be rocked forward or backwards, or there can actually be a tilt, like a tilted type pelvis. Or you got to realize, there's so many issues that can lead all the way up to the upper cervical spine here, which can be causing issues. So from the cervical spine going down, everything is connected by what's called a dentate ligament or denticulate ligament. And what that does is it literally connects all the way from up top in the upper cervical, going all the way down to the sacrum. So a lot of times people may actually have an issue that's going on up here, but it's affecting literally what's going on all the way down at their feet, just because, issues of how the spine, if something is out of alignment, it can really just throw everything off. So when I'm going through it and I'm feeling everything, I'm feeling a little bit of what's called edema and a little bit of kind of like a sponginess feeling over this left SI joint right here. So this is going to be an area where I'm kind of just taking a mental note of and marking off. And then when going up her spine, also I'm getting a little bit more tightness on that left side right through here. So these are going to be areas that I'm really going to check for after I make adjustments and see if I feel that muscle, if it's releasing in tension or not. So those are things that we check for.
So we've got hellos from France and England.
Hi, everybody.
We've got Joselito La Hamana, I probably butchered that, sorry. He says he's your #1 fan from the Philippines.
Oh, that is awesome. That is completely awesome. That is so cool to hear. I mean, with being all the way in, the United States and getting people from, out of country, it's just so crazy to realize the amount of people that, that I reach just with, as being, with simple chiropractic adjustments. It's amazing the fan base and people that actually can learn from, just simple things that I'm doing as a chiropractor and actually the whole chiropractic profession, in all. So many people just think that a chiropractor is there, they crack your back, they get you out of a pain, it's only for back pain, low back pain, or a headache, but it's completely not true. With how the body functions, with the brain controlling it, your entire body and the entire function and how that brain works. I know I said it in the beginning, but there's probably now more viewers on here. So the brain controls the entire function of the body, and what it does is it sends messages down the spine, out the spine, going to every organ, cell, and tissue in the body. So what happens is if there's pressure that's put on a nerve, just say like right through this mid-back or in this upper back here, you got to realize that nerve could be going to her lung, it could be going to her heart. And if there's pressure on it, think of it as like a hose, a garden hose that has a kink in it. If you have a garden hose on and there's a kink in the garden hose, the water isn't going to come out as strong on the other end. So it's almost the same type of concept. If that nerve is being pressed on, it's not going to work exactly the same way as if there was no pressure on it. So as a chiropractor, what I'm doing is I'm going to release the pressure off that nerve, and then from there, half her body is able to heal and function as it should.
So a lot of people are requesting the ring digger.
We will be doing the Y strap today, and I will show everyone a whole rundown how it works, how I do it, how you can do things actually to make it more powerful, and just how it's very user friendly and it doesn't kind of wrap around your neck. It's very simple. So I will definitely go through that a little bit later in this film. So what I'm doing in here, a couple things that I'm looking at. So I'm feeling some pressure more on her left side compared to her right. So this is going to be one of the main areas of making an adjustment. And then also what I want people to see, so if you were to stand from either the front looking down, so her body is rotating off to this right side here. So if you were to take a look all the way down, you see how she's tilted off to this right side? If you look at her glutes, her left side actually looks wider like this, and it's not a bad thing. I'm not like saying anything like that. It's just how your hips are and how your hips are sitting. You have one because those will hold the leg laying down. So this is why as a chiropractor you look at the entire body from all the way down to toe. So I'm going to go ahead and get started here. So right up here is where we're going to be making. Now typically every chiropractor out there, they tend to follow. I know a lot of people you hear, Gregory Johnson, and he does the thing on everyone, which it is kind of true. He's doing the same type of adjustment on everyone, but what people don't, the adjustment, especially that I'm going to make right here, I get that adjustment from her vertebra of T1 going all the way down to T3. So it depends on which line is placed and exactly like where I'm doing that adjustment. It makes T1 on the left to T3 on the right, but that adjustment looks like I'm doing boom, boom on either side. And it's the same thing with a lot of chiropractors out there. It's more of a to people, and the doctors that really do get great results, they kind of perfected their techniques, and to be honest with me, it's amazing because from graduation years ago, I was able to literally work for some of the greatest chiropractors out there, and I've learned so much. So now, when I deliver adjustments, it's the result, and that's why, I get emails daily for, wanting to come and see me out in Greenville at the new office. It's just an amazing thing, just the amount of people that I can reach with the videos that we do. Here we go. I'm going to start.
Where should my head be? So I'm right in this.
Yep, right in the middle there. Yep.
Okay.
And here we go. We're going to start with that first adjustment right through here. Good. Okay, so go to the other side. There. Getting some movement through here. So now from here, how I always do things is I start to go down the third, coming right through here. Take a deep breath out. There we go. You're feeling that, hearing that.
Yep.
Deep breath in and let it out. Good. So after I do that thoracic spine, I tend the lumbar spine, pelvic. So what I want to do is I want to check to see if it's a little bit more of the hip issue or if it's an issue. So what I'm going to do is I'm going to push down on your sacrum here, and I want you to raise, I want you to lift from here as high as from there as high as you can for me. So I'm going to put pressure down here.
Okay.
Raise this leg as high as you can up. Any pain to?
Oh, it's tight. Yeah.
It's tight? Okay,
Yeah.
relax.
Okay.
Raise this leg up for me. How does it compare to that side?
This side's tight. They both kind of feel tight.
They're both tight? Okay. So what we're going to do, we're going to do a little bit for either side of the sacrum just because she's getting a lot of pull. So what I want you to do, I want you to drop down on the table so you're more over this drop piece on here. So I'll tell you when to. Perfect. Yeah, just, you can turn, yes, like that. So I want you to start cross this leg over that leg for me, just like that.
Okay. Whoa.
So that, drop down like that, okay?
Okay.
Good. Good. Now I want you to,
Okay.
and I'm going to come on the other side. So what I'm doing is I'm helping open space on that on the right side of the sacrum. Now I'm coming around, I want to work more on the left side.
Okay.
So just because both of your SI joints were very tight, we're going to work on.
Okay.
Okay, you can uncross your legs.
Okay.
Good. Here, that we help get a little bit more movement area. Now what I want you to do, I want you to lift one leg up at a time. How you were.
Yeah, there's a lot more movement.
Do you notice that,
Yeah.
don't you? Alright, even
There's
watch,
a lot more movement.
even watch. Do it on this before. Okay?
Yeah.
And the other side.
Yeah.
What do you notice?
It doesn't feel so tight.
Adjustment on you.
Never done this
I've
adjustment.
never done this adjustment. She's never felt that. And for the first time, you notice a difference,
Yeah,
don't you?
a complete difference. Oh my goodness.
Good. From there, what that is, it just helps free up those SI joints. And now what I'm going to do, just because I was feeling a little bit of tension, I'm going to have you lay on your side and face me. This way.
Okay. Like this?
Correct, but I want the bottom leg straight and the top leg bent.
Okay, what is it?
Perfect. That's actually, I'm just going to bring your arm like
Okay.
that. Good. Just like that. You can relax.
So Ola Law is asking how much would it cost for a session roughly?
At the office, so well, I mean, it's a little bit different, depending on if you have insurance or not. If you have insurance, obviously, whatever your copay or deductibles are is what that would be. But if you were coming in as a cash patient at the Greenville office, we do $100 for the exam fee. Now the exam fee consists of both the chiropractic portion of the exam, which I'll go through range of motion, I'll go through orthopedic testing, and I'll go and do a full head to toe x-rays on every patient. I want to see exactly what's going on. But then also what's included is the medical portion of the exam. So at our office we have an entire staff of medical doctors, chiropractors, physical therapists, nurse practitioners. It's an integrated office. It's not just chiropractic. What we're doing is we come up with a complete, well-rounded plan for not just, as a chiropractic patient, but, as a patient in general. One, to help them if they're in some type of pain, to get them out of pain, and then also, keeping them guided through a very nice wellness maintenance type plan. So some of the plans that we do offer may not just be chiropractic. You may come in, and a typical visit may be coming in, getting a chiropractic adjustment, seeing our massage therapist, getting a 30-minute massage, and then also going and doing rehab with our physical therapist. Because a lot of times, as a chiropractor, when I make an adjustment, there are different parts of the body that may be able to, just say if someone has like a shoulder pain or hip pain, after the adjustment, yeah, they're going to be able to move better, but I don't want their spine to go back to alignment too quick and their muscles to tighten up. So that's why we have the physical therapist, which will then be able to spend, another half hour or even hour with them and go through and do certain stretches and exercises to help maintain the adjustment that was just done. So our office is very well rounded, and I'll be doing a lot more videos in the office like that. But today what we're going to be doing that side posture adjustment right now. So perfect. You're gonna have
This leg, where are you going with this leg?
this leg, I'm having your foot behind here,
Okay.
and I'm rolling you just like this.
Okay.
I've got you. So literally, you're going to feel like you're rolling off, but you're not going
Okay.
nowhere. I'm here.
Hmm.
There you go. And you felt that.
Yeah.
I can hear that from here.
Exactly. All right, I'm going to have you flip to the other side.
Okay.
So now on this side, now what I'm feeling, so I know a lot of times, people see chiropractors and they say, oh, you're doing both the sides, that adjustment on her L5 segment. Now what I'm going to do, so I'm going to roll you towards me.
I feel like I'm gonna fall.
You're not going to fall. A conception that a lot of people have, especially with doing this side posture adjustment. And first, I'm going to feel if there's any tightness going up,
Okay.
which there is.
Yeah. Oh yeah.
There is tightness. So from here, there we go. We're going to hit that other side.
Okay.
Now I want you to just lay flat on your back.
Okay.
Scoot up on the table for me.
Okay.
So with this, I like to go ahead and do a leg pull. So I'm going to push you up a little bit more.
Whoa!
I told you to go up on the table. I got you. Don't worry. So relax your legs. So
Okay.
what I'm going to do is literally a leg pull going all the way down. So I know that she does not have any surgeries done. She doesn't have any metal in her body. Anything like that. There's surgical screws, pins, anything. So what I'm going to do with this leg pull is I pull literally as it sounds from the leg. So it's going to affect the ankle, the knee, the hip, but then also the cool thing, and I think it's cool, I know it's kind of lame, but so in the low back, the psoas muscle is the only muscle that connects from that femur going to the actual lumbar spine. So when you pull on the leg, what's going to happen is that psoas muscle will pull that lower spine and help realign that spine and where it needs to go. So you may feel this pull going all the way into here, okay?
Oh wow. Okay.
So there's a lot of people requesting a full foot adjustment.
A full foot. If she needs it, I will do it.
And a lot of people are asking how much you actually charge for a full chiropractic adjustment. What's your
Oh,
treatment
sorry.
fee?
So
You got a little sidetracked there.
I did. So after, I'm sorry, after the $100 and that covers all the examination process, cash pay would only be $40 a visit after that.
Now, if you were to do, or if they were to do a video for you,
For the office and for me, typically it would be like a free adjustment for that day of doing a video is typically how I do things. But yeah, a lot of people, to be honest, don't like to be filmed, and there's a lot of adjustments that I make that aren't on air. Where, at the office, behind scenes, chiropractor. But yeah, I would love if there are patients that do want to come out and and do the videos, especially if there are real issues that are going on. Like my main thing is, the reason I got into chiropractic is to actually help people and not with, all right, well, I'll kind of dive into, I was working in a hospital and I was working on a med, it was years ago when I was just a nurse assistant, and literally all I was doing was like cleaning up, just awful things I was cleaning up. Anyways, the worst thing about being on a med-surg floor was the patients that you dealt with, they were coming in for open heart surgery, they were coming in for, getting like half their leg amputated, And the reason that these things were happening were because of simple, like dietary or just issues that could have been prevented in their life if somebody would have actually told them. Typically if there's something going on, you get a doctor that's like, take this pill and here you go. Still live your lifestyle of eating, fast food 7 days a week, 5 meals a day of it. And then you wonder why, oh wow, now I need to get half of my leg amputated because of a diabetic neuropathy, and my body's now, eating the rest of the leg. It's such a hard thing with me having to go into work every day and seeing these patients, which are awesome people, but have awful things being done to them. But these could have been prevented if, 20, 30 years ago, not even, sometimes even 10 years ago, if someone would have told them and would have been on them about dietary habits or just exercise or even little things. So now in my position with being a chiropractor and typically I'm dealing with patients that, they're not at that level yet. They're not needing a surgery just yet. They're looking for ways to obviously prevent getting surgeries, prevent, being on medications. And this is a field and a place where I can actually help people, at this time. And literally it's amazing. So a lot of times, I do have patients with, real major issues, not just, trust me, every issue, is a complaint, like a headache, trust me, daily, weekly, whatever, that is that,
Big deal.
that affects your life quite a bit, but there's so many things, a lot of people don't realize any gut issue, irritable bowel syndrome, diverticulitis, just different issues even in the gut can be from the nerves having pressure on them. If there's nerves on the, if there's pressure on the nerve that's going to, your small intestines, your large intestines, or even your stomach, how do you think, those bodies are gonna release the chemicals needed to break down the food properly? Things aren't gonna break down as they should, issues of even like an irritable bowel disease, things like that, I have seen and have helped just by straightening and realigning the spine. Trust me, and a lot of people out there may look at me and be like, you're crazy, you cannot help a stomach or dietary issue by realigning the spine because of a curvature in the low back. It is so hard to wrap your head around, but so many people have that medical model in their head, and they just think that you have this issue, you need a pill, you need a drug, that's the only way something is going to cure. People don't look at literally the easiest thing right in front of them. Your spine is supposed to be literally straight up and down. You're going to have, the 3 curves in your cervical spine, your thoracic, and then in your lumbar and sacrum. You've got those nice healthy curves in your spine. We have these curves because they're intended for weight distribution, one, of the spine, but also they allow the nerves to exit the spine freely. And you got to realize what happens over time when the spine is out of alignment, when there's pressure being put on the nerves, not only does it affect what, the area of the body, what organ, cell, or tissue that nerve is going to, but at that spinal level, you'll start getting areas that start degenerate, and you get people will call like arthritic type areas, osteophytes building up, and this is because when you don't have the proper movement and you have that misalignment of the nerve, the areas just in that specific vertebra just start breaking down. And then it's like you get patients where they're 50, 60 years old and they're like, yeah, doc, can you help me? And I shoot a film and I look at the x-rays and I just see so much like degeneration in the cervical spine, a huge scoliosis, like the worst spine you could ever see. And they're like, heal me. And it's like, you look at them and as a doctor, I want to do my best with every patient, but it's just so hard, when you look at them and you be like, I will do my best, I will help as much as I can, but as a chiropractor, when there is degeneration already at that vertebra, at that level, any adjustment I make isn't gonna, reverse that degeneration. You may be able to, as a chiropractor, I may be able to help get a little in that actual disc, because if we start getting movement in the spine, you know, that's how, you know, we'll bring, you know, more flow and more fluids into that disc. But you got to realize, you know, if that disc is already starting to break down quite a bit, someone who started at 100%, you know, they you know, just destroy their body, drop it to 10%. After maybe coming seeing me, you know, their best may only be like a 40%. So at least I can help them a little bit. But you know, when you come and see a chiropractor, you know, when things are completely way gone, it's hard. You know, you kind of, it's like you're trying to throw that Hail Mary pass, and it just, you know, it just is difficult. But you know, when you come, you know, when you're younger or when issues aren't as bad, and you start with maintenance care. It's amazing. It's amazing the things that people, you know, never experience. You know, that's awesome when you have people that are like back pain, neck pain. Like, dude, I don't have that. Like, yeah, that is amazing. That's how everyone should be. When your spine is aligned and the nerves have no pressure on it, I mean, everything is literally in line. Everything just flows perfectly, and that's how we want everyone. You know, typically when I have patients, like, yeah, in the beginning, I may have to see them, you know, multiple visits, you know, a week, but my end goal is to basically see a patient once a month. Yeah, and maybe for, you know, years, but you got to realize what's $40 a month, one visit a month, and now, you know, if you don't have to experience, you know, all these different, you know, low back pain, neck pain, your headaches, just degenerative diseases, you know, when you're older, you can then actually enjoy your life. Picture if you're going to retire. You know, you spend your entire life working, and now you're able to actually retire and enjoy your life instead of having to sit there and be in a nursing home and be stuck on medications, not being able to walk. Picture being able to, you know, to not be able to play with your grandkids or something. It's awful. But let me go ahead and start going back from here. I want to do your thoracic spine. You know, I'm getting a little caught off topic. Sorry, guys. So I'm going to do things a little bit different. I know some of the viewers have seen me do this, so I kind of want to do this on film for everybody today.
So what are we doing?
I'm going to have you stand up.
Oh, okay.
I'm going to have your back to me.
Back to you.
Yep.
Okay.
Your arms out like this.
Okay.
Good. I am going to come around.
Well, what are you doing?
I'll put my arms.
Yeah, but what are you doing?
I want you to put your fingers interlocked. You got them hands? Put them over my hands.
Okay.
Okay.
Okay. So you got to.
So this is going to be a thoracic spine adjustment.
Okay.
What I'm going to have you do, I want you to lean back on me, and I want you to squeeze your elbows together.
Wait, what am I doing?
Squeezing
my elbows together.
Squeeze
And
them.
I'm.
And you're going to fall back on me. Squeeze your elbows.
Okay.
Good.
Oh.
Now, did you feel that?
Yeah. Up my spine.
Uh,
Yes.
I know, it's a different type of adjustment, but it just, how it moves the spine, it really hits that upper vertebra in the thoracic spine very well.
Yeah.
I know, it's
Yeah.
not. Alright, I'm gonna have you now take a seat right here for me.
Which, like this way?
Yep, that
Okay.
one for me.
Alright.
So now, this is typically how I do it's called an anterior thoracic adjustment, meaning anterior is face up, like a supine, meaning face up position.
Okay.
So
So what are we doing?
So I'm gonna have you cross your arms
Okay.
just like that. I'm gonna be having you take a deep breath in,
Yep.
and then I'm gonna start bringing you down the table. As I bring you down, I want you to exhale out
Okay.
completely for
Got
me.
it.
So
Okay.
take a deep breath in, and exhale out for me.
Oh wow.
And you felt how that was?
Yeah.
Right, okay, good.
Yeah.
So now, I mean, I've done a prone thoracic adjustment to help clear the spine. We've done a standing thoracic to get that upper,
Yeah.
and then we just finished clearing out that thoracic spine. So we're really, you know, cleared out in that area. We've
Yeah.
taken a lot of pressure off the nerves just through there. Now what we're gonna work on is gonna be the neck.
Okay.
So I'm gonna have you sit up,
Okay.
and you can face me this way.
All right.
So we're gonna do some movements as a seating position.
So what are you gonna do?
So I'm gonna do the seating
Okay.
neck adjustment
Okay.
because I know I've adjusted you before and laying on your back, you tend to tense up. So you got to realize as a chiropractor, there's tons of different ways to do an adjustment. You can do it sitting, you can do it laying on your back, you can do it laying face down. It's whatever puts the patient at ease and, you know, relaxes them, make an adjustment.
Okay.
So in here, what I'm feeling for, like I can already feel just on this side of her neck here. You know, she's got areas that are, like her spine is rotated. So all I'm gonna do, we're just gonna bring her ear down to her shoulder. I'm gonna rotate up. Alright, get a little bit of movement through there. Now we're gonna come around to that other side here.
Okay.
We're gonna do the same thing. So ear down to that shoulder. Yeah. So I want you to relax. There we go. Relax, relax.
Oh.
You see how that you
Yeah.
felt it?
Heard that
Yeah.
one.
Yeah, so even with the rotating more, we got more on that
Yeah, you
occiput
did.
on that right side. So a lot of the times, even when you do that adjustment, one side may be a little bit more stiff than the other, just because your body, you know, that it's out of alignment. Your body, the muscles are guarding that area. You have to trick it and
Yeah.
do the adjustment on the other side to make things move. So in your case, that's really what we had to do there, just because you were, you know, muscle guard.
Muscles tensing up.
Yep. So now what we're gonna do when I clear up the entire spine, so now that I have the areas out of a rotational that are back into alignment, this is when I'm gonna go ahead and we're gonna do that Y strap and we're gonna decompress the entire spine.
Okay,
So
so
this-
what are you doing this
Turn
way?
your feet that way.
Okay.
So let me show everybody what a Y strap looks like. You got the handle at one side, you got the strap this is gonna go around the base of the occiput. So we're gonna start like this. This strap is gonna go around. We're gonna have you pull your hair through for me. Good. And as you can tell, the strap is sitting, you know, at C1 to the base of the occiput here. And what we're gonna do is we're gonna have our patient lay back.
Okay.
You can keep your knees bent off the table.
Okay.
So now, I'm just gonna set this down just for a second here.
Okay.
The reason I have her knees bent is because it's gonna hold her onto the table. Because you don't need a lot of force to pull on the Y strap to get, you know, the adjustment to go all the way down. Now, times where, you know, there may be something that's so locked up and it may just stop, you know, halfway through, or I may not pull as hard as I need to, and it may only stop halfway through. But at times, and here, I'll actually have my wife hop in. Everyone knows Mama Sip here.
Hi guys.
So at times, what I'll do is I'll have, you know, like in this hold down on the knees right here. Now what that's gonna do is, now she's not gonna be able to move on the table. So when I distract, she's not gonna go anywhere at all. A lot of the times, you may ask for this video, I do have an assistant, as my wife with us, and we're gonna be able to do it. So one thing, obviously, when I look down and check, she's fine with earrings like this. If she had the long dangly earrings,
You have to.
I'd have to have you remove them, but
Yeah, there's no way.
yep, and like this, what we're gonna do, we start from here.
Okay.
So we're gonna bring the strap around, and I'm going to distract this direction, and then I give a slight pull at the end. And what that's gonna do, she's gonna feel go all the way down her entire spine. Decompress, it's gonna take pressure off the nerves all the way from the occiput down to the sacrum. Now at times, because you gotta realize, if you look at the kinetic chain, of the body, when I talked about in another video, she may feel it all the way down to her knee, just because, like I was saying, that psoas is the muscle that connects from that lumbar spine, goes down the femur, and it goes all the way to the knee, exactly where my wife was putting pressure down onto. So if I get a good enough pull, she literally may feel this all the way down to her knee, whereas that patient on my last video was able to run again with no a Y strap adjustment that he felt all the way down into his knee. But here we go. So here we are going to start this Y strap.
Oh, wow.
So I'm going to let you relax.
Wow.
So the one thing, even when you see like ring dingers done and you see people's face, they're like, oh my gosh, what just happened? Because everything just gets decompressed, and it's like almost like a wow moment. Because everything going all the way down, you got all these neurons now firing off, and it's like, holy crap, what just happened? Everything, all the information down the spine can now be, you know, transmitted with, you know, with no pressure, no irritation at all. So what happens, you know, right at first you're like, oh my gosh, but
Yep.
you know, this was the one last time when you were really having those bad migraines and headaches that really just freed everything up. And it was what, a couple weeks before you, 3-4 weeks I think you said, before you got another migraine?
Yep.
So this was one of the main things, so
Are you taking me up?
I'm gonna take this down.
Okay.
Give me a second, and I will help you up. So I'm gonna help you up here.
Oh.
There we go. So now after that, you felt that go all the way.
Oh yeah. I totally felt that all the way down.
Like that feeling, I mean, it just really,
Yeah, it
kind of describe, because I know a lot of people, especially one thing they look at, they don't realize how powerful that adjustment is.
Well, and some people were also asking how you feel in the next couple of days after the wire strap, whether you're, sore in the neck area or not.
So me, immediately as he does it, it feels different, but and he knows this because he's adjusted me before. I can't get up immediately. I just have to lay for a moment and just like let it relax because it's such a powerful adjustment. So I don't know, I guess I'm like a little bit, dizzy.
Yeah, because you get so much more blood flow and the neurons are firing and just.
I just have to lay for a little bit and then get up, but it feels amazing. Like now, like I feel so much more like relaxed and relieved, and it's an adjustment. It's actually one of my favorites.
Yeah, and at first
when we did this adjustment, I was terrified. But now that I've been getting this adjustment, it's awesome.
To be honest, this is one of the best things ever. Now, the main reason on why this adjustment is done, you realize every day there is gravity. Gravity is everywhere. It's literally putting pressure down on our bodies every day. So you got to realize every day, no matter what you do, there's always gravity. Bring me down, bring me down. Why do you think you see little old people, when they're 70, 80, 90 years old, they're down, they're smaller. They started off 6'5" and now they're 5'6". It's just gravity over time. Their muscles, weakening and everything, just bringing them down. What this Y strap, what it does, that adjustment, it pulls everything apart and it just opens everything up. So with all the gravity that's been pushing down and decompressing that spine and pushing, boom, everything all at once. Not just in the neck.
No, it is all at once.
It's
all at once.
Yeah, you're there and it's like, whoosh, like, oh my gosh. Everything just happened, and even for me, the first time that I had that done, I learned this technique. This is the best thing ever.
It's
like
really good adjustment.
the feeling after is just amazing, and just even how how other doctors, especially with the ring ding, or how people are like, oh my gosh, the best adjustment ever. It's because it is. That decompression feeling is just absolutely amazing. So, I would love if anyone is in the South Carolina. I'm specifically in Greenville. We have a new office that's opened up. It's Palmetto Physical Med. Find me the website at palmphysmed.com. You can directly, if you're wanting to get your new patient evaluation and adjustments. It's my name, Dr. Joseph Cipriano at gmail.com. From there, I've been seeing people, literally the office is open. On Monday is the first day it is open. And already that day, I think I have 7 new patients alone just from people watching YouTube videos. So it's amazing just from one simple thing of getting involved with YouTube and just being able to put my videos out there about now how many more people I'm able to help. So it's amazing. Thank you guys for watching, and just thank you for everything.
And I was actually gonna have you go through some of these questions and maybe do a 5-minute Q&A if everybody wanted to kind of go through some questions with you.
Let's go for
Okay
it.
with that?
Yeah. So I guess I'll have you help me with these questions here.
Let's see.
Having
Crazy difficult. It says I need this adjustment. I think my neck and my pinched nerves.
yeah, for Conte's world, yes. Honestly, you probably everyone's need that Y strap adjustment. It'll take pressure off all those nerves, literally from the neck going all the way down to the lumbar spine.
Let's see.
I know, sorry, I'm reading some of these. I'm reading from, I'm gonna butcher all these names, please don't get mad at me. Joselito, I don't even wanna try, with an L, that last name. Yeah, Dr. Joseph is like an x-ray, he sees what happens, that's amazing. I mean, I really do, I scan the body, it's just, as a chiropractor, how you look at the body and the body composition between the muscles, ligaments, and the spine, it's just amazing, and just following, just following how the body works, it's really simple. Let's see, let me go all the way up to the top here. Oh man, alright, I have one problem because my wife is suffering from some foot pain. I'd love if you could show one trick how to help a little. This was from Hypnostratos, is the name on here. So it depends on what's going on. If she's feeling, actually that you don't have shoes on, is her foot, well, I don't need your foot out. Well, pull it while you're at it.
Take my sock off?
Yes, please.
I don't.
Okay, never mind. Don't take this off.
I don't have a penny, everybody, and
All
my
right.
feet don't look pretty.
All right, she can do this with her sock.
Okay, with the sock,
Sit.
my beautiful sock.
Depending on what's, she has her right sock on the left foot. Anyways, here we don't know our left and right. So
Their socks, who cares?
Anyway, so depending on what's going on, a lot of times what happens is there's a loss of arch right through here. You could be having more pain, on the heel of the foot. There's different stretches and exercises that one may do. You have simple things. Let me come around this way. I can't tell where the camera's at. You have different things. If you're barefooted and just say you have a towel on the ground, one thing that's good is you want to scrunch your toes and grab that towel. Or if you have, I know this may sound weird, a bucket of rice, put your foot into a bucket of rice, uncooked rice, not let me, I gotta be very frank here with what I say. A bucket of uncooked rice, put your foot in, and just practice your toes together. What that's gonna do is it's gonna strengthen that arch in the foot, and that could help right through there. Now, depending on what issue your wife is having, is gonna kind of change things up a bit, or where she's feeling different issues. It could be, around on the balls of her feet. It could be even from, like a ligament strain or, brain muscle strain, something like that. So, there are many different ways. I do have a foot adjustment video actually done on my, that may be able to go over some things a little bit more. If it doesn't, if there's something in particular, shoot me an email. I'll feel free and I'll email you back different stretches and exercises.
I just put my foot in a freshly cooked bowl of foot. Thanks, Doc.
Uncooked rice. Just to clear things up there. I'm sorry, guys.
That's awesome.
Let's see. Any good chiros in the Netherlands from DKLK? Honestly, a guy that I would have to get back with you. I can't remember his name. It was a buddy I went to school with. His father is actually a chiro in the Netherlands. I'm not sure the name of his office. I haven't even talked to him. I know that he does get a lot of good results. I've met him many years ago, actually, when I was still in school, and that would be one I'd really have to look for the name. Can you find any other questions?
There's somebody. I think Gregory Johnson pulls too hard when he's doing his ring dinger.
The thing is, he's a professional. He knows what he's doing, technique. I know, especially when I use the Y strap, I may not pull up here just because not all people's bodies are the same. Here, I'm not gonna, rock her like she's a, 6'5", 300 pound, linebacker or something. You gotta. For me, I adjust to, the patient that I have on the table. I do this Y strap adjustment on 70, 80-year-old little old women. And the thing is, I'm not trying to make them feel, the decompression all the way down. What will help is just getting even just a little decompression right up in the cervical spine, and I'll do things very lightly. And really all a judge of what you think the patient, what they can handle. Next question.
Somebody is asking if you're a crack addict. That's that other channel, isn't it?
Am I well, saying are you a crack addict in general, love hearing the pops. To be honest, when doing an adjustment, you don't always hear something pop or crack, like especially when I was doing with the drop table on your
There was
SI.
no noise. There was no pops when he did the drop table.
Yeah, there's no noises at all. Even sometimes when you're adjusting, just say up in the neck, when you go to make an adjustment, you may not actually get, that pop, that crack. All that is gases being released, but you may still get movement. What you want to check is if you got enough movement. Like even just now today, when I went to adjust the one side of her neck, she still wanted to fight me because of muscle guarding. So what I did, I went to the other side to still adjust that same segment, but just doing that adjustment from a different angle in a different way. And I was able to move and just clear, and you did actually hear the pop sound after.
Yeah. He made a ton.
Oh,
XX Gamer throws a ton of people cry about how much force he uses to pull on the ring gainer. I have not seen anyone cry on the Y strap. I've gotten the Y strap several times now. I've never cried on the Y strap. I just have to lay down a little bit and just go.
But I also judge on, obviously if you see me pull, I'm not the strongest guy in the world, but
Well, yeah, you're not yanking me.
I could literally rock her,
like,
especially because holding her knees down, I could really get a lot more force, and guess what? She's not going anywhere. Now the one thing, especially how I do it, that she's down, is even if I do use too much force with pulling, it's gonna lift her body up off the table, and it's only gonna pull to what her body can handle. So I kind of typically like to guide it with that, just because I don't want to overstretch or overstimulate an area and really injure someone.
A couple more comments here. So Dr. Joe Robertson, love your work, Dr. Sip, from Dr. Joe in Texas.
Thank you.
Hey, from Zurich, Switzerland, like your videos.
Dude, that's awesome, all the way from Switzerland. Dude, I love it.
So Picante's World says I get on pop in the middle of my back when it gets adjusted. Besides my neck, not everything pops when the adjustment is made.
That is, not all the times you do feel everything with an adjustment. A lot of times, you may do something on one side, it may not move how you wanted it, and that's why you typically do the other. Hold on, I mentioned from Adriano, Brazil, Sao Paulo. What is the hardest adjustment? Typically, and no adjustment is hard, but a lot of the times, especially in the upper neck, you get patients that have a lot of muscle guarding. So a lot of times, I appreciate a little bit. I don't like to force any of my adjustments. If the patient, like if I'm doing any type of what's called a rotary, like with her neck, with turning any rotations, I don't like to force that. If it's going to move, it's going to move with just a quick, tight movement. So I would say no adjustment is actually hard. It's just depending on the person. They may have, a neck that are completely stiff and they don't turn or rotate or laterally bend. So it's kind of dealing with, difficult type patients. But, that's why, to be honest, that's why when I have patients like that, with using the Y strap, that helps get so much more movement. And then after doing that Y strap, even on people that would be a hard patient to adjust, they start moving and they can get a lot better range of motion just after that.
You have Nuno Marquez. He said, "Hi, Dr. J from Portugal."
Dude, that is all the way from Portugal. I'm so glad. Being out here in Greenville, South Carolina, that I'm able to, reach people all the way, in a different country, like in Portugal. This one, hello, Jared from Zurich. Like,
wow.
these are what's another one out there?
Did you see Dr. Johnson's reaction to Dr. Jason's video about his ring dinger?
Specifically, I have not specifically seen that video, but I don't know, maybe specifically I did. To be honest, when I watched that video, I was in tears laughing. Specifically in tears laughing. Nothing against Dr. Jason. Everyone
He's
adjusts.
cool.
Yeah, he seems like a cool guy. Everyone, they have their own style of adjustment. I know a lot of people thought with my video, better than the ring dinger. I was not, going at Dr. Johnson, and I know a lot of people don't realize, but he did respond back to me.
Positively.
Yeah, and all he said was he applauded me for doing a adjustment like himself with the ring dinger, and it's not ever trying to put anyone down. It's just everyone has their own techniques. But yes, that video, that comeback specifically video, dude, that did have me rolling. Just it really did. If you guys haven't watched it, I'll promote that video. That was
funny.
that was hilarious. He'll give a prize to anyone who can count how many specifics were in that. That was just great. Alright,
Dr. Joe, you got a good one here though from Hypnostratos.
Yep.
Could you show me how to do a foot adjustment, please? It's for my wife. Maybe just show one technique.
Well, so the thing is, as much as it's like showing an adjustment, it's easier said than done, because it's, for one thing, I went through, and a lot of people don't realize, just with going through school, I did 4 years just for my bachelor degree, which major communication, minor in biology. After my 4-year degree, I did another 4 years for my doctorate, and that was a doctorate of chiropractic. So many people don't realize that I spent 8 years in school just to get a doctorate of chiropractic. And then also on top of that, we had, not as much as a medical doctor with, oh my gosh, not an intern, but when you're,
Resident?
Thank you. A resident. A residency is a 2-year thing, whereas a residency in chiropractic is not as much time. But with chiropractic is also the 4 years for a doctorate. So when trying to just say show how to do an adjustment, there's just so much behind the amount of force. It comes down to a lot of times muscle testing and seeing what may actually need to get adjusted and what may actually need to move, because you don't want to move something that is already out of place, and you don't want to put something in a worse position than what it is. I would definitely say if there's some type of foot issue going on, see if it is just it could just be a muscle type issue. I would try, just rub down the ankle and the foot first, and I would try with doing something like that, and doing an ice, your normal, what's called RICE. R for rest, ice, compress, and elevate. I would start off with something like that first, before trying to do any type of adjustment. Yes, you were gonna bring something up.
Somebody was saying, I don't think Hypno wants to try the adjustment, he just wants to see it. Didn't you do an adjustment on a foot?
Yes, I did do an adjustment, on my wife's foot. Feet by that. And literally going through the adjustment, I went and did, every bone in the foot. I did all the different, the metatarsals, and I will definitely do another foot adjustment again. I just need to find the patient that actually is, one coming in, with the complaints of foot issues. So I know, I would love to just start, as a chiropractor, I can make things pop and crack and whatnot. That's the easy thing, making things move. The point is knowing what actually needs to be moved and what does not need to be moved is going to be your main issue with that. So when I do have a patient that really does need that foot adjustment, yes, 100% will put another video up. I'll even do a live video on foot and lower extremity adjusting.
Here's one here. So this one's from Imperatore Pallido. Here in Italy, they don't even know what a chiropractor is.
Yeah, there are chiropractors in Italy, very few and in between. There was actually a girl that we graduated right around the same time. She ended up, an all-American girl, and moved to Italy and actually opened a practice up in Rome. I don't really keep in contact with her that often, but I do know that there are chiropractors out there, and she also graduated from my same school as well, and it may just be a little bit more difficult to find. I know, here in America, definitely if you're in, more of like a major city, you're gonna find a chiropractor every mile, maybe even multiple, within a square mile. So, I know people that actually have, the chiropractor, easier than, out of country. Let's see, any other questions that we have going on?
Mississippi is gonna get mad, Doc.
Oh, you're in
We're
Oh,
going.
you're Italian spot check, hey.
See, here we are. She also has people watching.
That's awesome. And she put my sister's here from Italy and she's a chiropractor, but we're in Toronto, too far, LOL.
Yeah. Obviously there are chiropractors in Toronto as well. I mean, there's chiros all over. It's just it does take a little bit of time finding the right person, to get adjusted by. Everyone, they have different techniques. You learn in school multiple different techniques, but when you're in practice, you realize that some people's spines move differently than others, and different techniques work better on certain people. So it's really, it takes a little bit of time to find the right chiropractor where you can get the results that you're looking for. So, to anyone out there in different states and different countries, definitely try out different chiros, find one that you like and stick with that person. But, if you guys are ever in the South Carolina, Greenville area, please feel free to stop in. I would love to see you. I'd love to, go through to a full exam, do the adjustment, and, even if you guys did want to do a video, like, that would be awesome as well. I love whenever I get the opportunity, to make a video. I got really lucky today about being able to, do a live video, considering this is my first live video ever done. And it's actually really exciting that you guys get to witness it. A lot of times I get people who are like, oh, he edits in the sounds and pops. Like to be honest, I can barely even check my email, and you think that I can go and figure out how to, add in specific sounds at a specific. Oh gosh. Specifically add specific. Oh my gosh. All right, yes, I'm not that computer savvy, so no.
Okay, so before we finish off, Picante's World has one more question, and I think
Shoot.
we're golden.
Okay, so Conte's World, I have a question about
Foot adjustment.
foot adjustments on
The fifth metatarsal adjustment, that it's protruding, causing wound diabetics.
So, I mean, you could be almost talking about like a diabetic neuropathy, or in that fifth metatarsal, it would be called like a metatarsalgia. Depending, I mean, these are things like you would have to actually look at in different tests. If you were to squeeze your forefoot, just if you're literally to take your hand and squeeze it on the forefoot, if this right here really inflames it and it sends a lot of pain in the foot, there may be a nodule or something in there that may be pressing, on the muscles and ligaments and causing a lot of pain. A lot of times, especially with that, you got to look to see, one, it could be an old fracture that maybe never healed. It could be simple, misalignment in the foot. But, the only way to really tell what's going on, one is actually doing, a full exam on the foot, and then, if need, may actually, need films on the foot just to see, especially if there is a fracture. And then, if you have a fracture, casted, you're gonna obviously would have to, have weight bearing on that foot, for a few weeks, and crutches and the whole nine. It's just kind of hard to, say or know specifically going on without really having you right in front of me to examine. I hope that gives a little bit of help with that one. Anything else? Alright guys, I love to do a live video. Again, obviously I think you guys know me, I'm Dr. Joseph. I'm out in Greenville, South Carolina. If you guys do want to ever have an adjustment or see me, email me at drjosephcipriano@gmail.com. I would love to schedule and set up an appointment with you. Bye, guys.